Hello, I'm Alice and this is Lizzie and we're talking to you from the RCGP Research and Surveillance Centre. The RSC network consists of practices from across the country. We've been monitoring disease spread for over 55 years, but we had a huge increase in the size of the network during the pandemic, up to nearly 2,000 practices. This means we now represent around 90 million currently registered patients, which represents almost a third of the English national population. We moved to Oxford a few years ago and set up ORCHID, which is a big database that combines data from patient records with virology swab and serology sample results. These database outputs are used for RCGP weekly and annual disease reports, as well as UKHSA disease surveillance and research projects. We consist of a research group, data team and practice liaison officer team. Lizzie and I are part of the PLO team and you'll most likely be talking to us or other members of our team.
So as Alice has already mentioned, one of our main outputs is a weekly infectious disease report that monitors up to 37 different infectious conditions. It also reports on the virology and serology sampling that practices do, and it's mainly used by UKHSA to inform public health policy. So just a little example about the importance of the contributions that practices make. Here on the right we have a graph that shows antibody levels between dose 1 and 2 of the Pfizer and AstraZeneca vaccines, and each dot here represents a sample that's been taken. The blue dots are antibody levels from the vaccine, and the orange dots are antibody levels from natural immunity. We also were recently featured in The Guardian as the flu hunters, which provides a really useful overview of the work that we do and the importance of it.
The ORCHID Hub is a trusted research environment. This means that the data team and the research team only receive pseudonymized data, so no one can see the individual patient information from patient records. The data is secure, meeting all current legal and national data protection standards.
So because our data relies on coded data, it's really important for practices to produce high quality data reporting, which is why one of our mantras is coding is caring. And there are three main areas that we really focus on: problem coding and episode typing, vaccine exposure, and virology and serology sampling. And again, just to give an example of the importance of this, during the pandemic, we wrote a paper about the importance of coding long COVID. So just to go into a little bit more detail by what we mean, for problem coding, essentially this means being as specific as possible with the probable diagnosis of a condition. So for example, to code influenza illness rather than a symptom like cough, because cough is too vague. So this should be based on what the clinician thinks is the likely diagnosis. And just as sort of a general guide, we've got here a list of the infectious diseases that we report on through that weekly report. What do we mean by episode typing? Essentially that means deciding whether the problem is new or ongoing. And that's important for establishing the incidence of a disease. So that is how many new cases there are. That helps us to understand whether the transmission of a disease is increasing, or the prevalence, which is how many people currently have that disease or condition, which really helps us to understand the burden that disease might have on healthcare. The majority of infectious conditions would be recorded as new. We're also really interested in flu vaccine exposure. This is especially important this year because there are so many different vaccines available to patients. So we really want to encourage practices to record this. Flu is a little bit tricky because there are lots of off-site vaccines, so they're not necessarily into the patient record. So we do really encourage practices to try and record this wherever possible.
In addition to our routine disease surveillance via patient records, a number of our practices within the network also undertake active disease sampling. So the first of which is Virology Surveillance. To take part in this, we ask practices to identify patients who have current symptoms of influenza-like illness, acute respiratory illness, or suspected COVID-19. And the symptoms should have started within the last 10 days. As mentioned, anybody with an acute respiratory illness is eligible for a swab. This diagram just shows in slightly more detail the levels of coding that we're ideally looking for, if you can, underneath acute respiratory infection, including upper respiratory tract infection, lower respiratory tract infection, or influenza-like illness. Please be as specific as possible in your coding. If you take part in virology surveillance, there are two main ways to swab patients. The first is using in-practice kits in lab form. You can order a kit from our online order form, and the kits will be delivered to your practice. The patient can be swabbed during an appointment, or the patient can take the swab away with them and swab themselves at home. Please make sure that the form that comes with the swab kit is filled out completely, particularly with patient information, so that the results can be linked to the patient later on. Practice will receive full results directly from the lab and will be paid £12.50 per swab. You can also take a test to give swabs to patients online. In this case, all you need to do is give the patient the voucher code, which is the same as your practice code. The patient can then log in online using that voucher code and order a swab kit directly to their home. The flu and COVID results will be texted to the mobile number that the patient provides online, and the practice will still receive full sample results and payment of £12.50 per swab. In slightly more detail of these two different pathways, please check first that the patient is eligible for a swab and code the likely diagnosis. Then, once you've either swabbed them in the practice or offered them a voucher code, please code swab offered. And then when the results come back to you, please code those results back in the patient record. We have some guidance here of what to say to patients if you're not sure, either on the phone or as a text message. Just to emphasize here that the consent is verbal for these swabs. We have some top hints and tips from practices who are already doing a lot of virology surveillance. They've suggested things like bringing the entire practice on board and reminding the team regularly about virology surveillance. Please also identify which staff members are most likely to interact with symptomatic patients and make sure that they have kits to hand that are within the expiry date. You can also use flyers and posters in your practice and on your practice website that we provide, and set up an active messaging service or other patient service to contact patients. You can also have a look at your My Practice dashboard to see your swabbing numbers and results so far. You can also use swabbing as a diagnostic aid to see if the patient does have a virology respiratory infection. And remember, it's extra cash. We're currently offering £12.50 per swab, which if you do 20 swabs per week, this means £250. And over 6 months of 20 swabs per week, that would be over the winter season, this can amount to £6,000. We are currently asking practices to aim for 20 swabs per week if they can, but there is no upper limit. Just to show you what the Virology dashboard looks like, so here you can see the swabs that we've had recently from all practices across the network. You can use your dashboard key to hone in on your particular practice and see how you're doing.
So we also have a number of practices that participate in our serology sampling, and what this involves is taking an additional vial of blood from anyone who's attending an existing blood test appointment. Unlike virology, they don't have to be symptomatic. we provide the kits to practices to use, and like virology, we really try and emphasize that the lab form that's provided is completed fully, as well as the details on the blood bottle. And for serology, the payments are broken down a little bit by age, ranging from £5.50 for those who are over 18 years of age, and up to £30 for the under 8-year-olds. Again, we've just got a little bit of guidance on what to say and what to text to patients. Like virology, consent is verbal as well. Some hints and tips. We've had a lot of success from practices who have sent out text messages with the patient information sheet in a link ahead of those appointments. Patients then sort of come in and often ask to contribute that extra bottle of blood, and it saves time. But we have found that giving phlebotomists a little bit of extra time for taking that extra blood bottle really helps. Organising kits ahead of time and automating the process as much as possible. So using label printers, if you have that, stamps, and setting up shortcuts on your computer system for the coding. Updating the team regularly on the number of samples taken and the income generated also really helps. And we've had practices that sort of use that income to pay for specific things that the team might need or want, for example, standing desks.
Just to recap, so for virology and serology sampling, you can order more kit using our online form. Payments for all swabs and samples are processed quarterly, but please try to use up the kit that you order to minimise wastage.
So I think we've already made mention of my practice dashboard, and essentially using the data that we extract for surveillance purposes, we try to give back to our practices by using that data to also provide practice level informatics, such as to support data quality, to improve episode typing or disease coding, for example, for influenza-like illness. You can also use it to support any QOF targets and to keep progress on any projects, on any research studies that you might be participating in. We also have network-wide observatories that use data from practices within our network, for example, on workload and social prescribing. These are available on our website. And as part of our network, you'll also receive regular communications from the PLO team in our weekly and monthly updates. And these will provide some updates on the surveillance work that we're doing, as well as the available research study and guidance on coding and any publications that we may have published recently.
For all practices that are within the RSC network, we also open up opportunities to take part in other research studies. Here is a selection of research studies that we currently have ongoing, but please refer to our communications to see any up-and-coming projects that you might want to take part in. Thank you very much. If you have any more questions, do contact us at practiceinquiries@phd.ox.ac.uk. You can also visit our website and have a look at our project information there. We also have a 4th series of RCGP seminars where we talk to stakeholders and members of UKHSA about the surveillance data that we provide and what they use it for. So have a look there if you want some more information. Thanks very much.
Thank you.